politics, business, sports, arts, music. Mike and Marty on the beat. Mike and Marty. Mike and Marty on the beat. Mike and Marty. Mike and Marty on the beat. Mike and Marty.
Good morning, Bellows Falls and Keene, and welcome to the feed. It's Mike and Marty, and today we're here with Dr. Amichai Kilchevesky from Springfield Hospital. He's going to be talking with us about urology and the urology department. But first, Marty with local events.
So first I want to give a huge shout out to the Chamber of Commerce and Amy, because I hear it was a pretty successful Rockingham Old Home Days. And a shout out to the Lisi family and everybody that contributed to the fireworks fund, because the fireworks were, as usual, stunning. It was a perfect night. It was like the perfect day, perfect weather. Everything was great. Local events at the Bellows Falls Opera House this week is Superman. What version of Superman? I don't know. I don't know where we are. I don't even know who the Superman actually is acting as Superman now, but anywho.
It was me, I thought.
It was? Oh, okay. That's
There we go.
hiding in plain sight.
Yeah.
Yes.
I thought that's why I was here.
Oh,
Yeah.
okay, to talk about. So that's August 8th through August 12th. The classic movie is sponsored by Chroma this week, and it's The Jerk. I'm sorry, it was a funny movie. So last weekend, instead of going to Old Home Days, I actually went to Wild Goose Players. They are doing a production called Gruesome Playground Injuries. And I wish we could have gotten, I wish we didn't have time, but I wish we could have gotten David on prior to the event to really talk about this play.
Mm-hmm.
It's a play that happens at the Wild Goose Playhouse workshop. So it's right in downtown Bellows Falls. It's at their little like home layer, I guess. So it's kind of like a theater in the round. The chairs are round, the actors are in the center, very minimal set. Two actors, one of the actors is David's daughter, Rachel. The other actor is a gentleman that's been in a lot of David's productions. And it starts out, they're in grade school, I think they're about 8 years old, and it follows them, it goes forward and back through their lives, these two friends that kind of connect, they connect kind of in dysfunction. And so it does bring up some possible triggering things for people, but it also brings up some thought-provoking issues. And I think David is really good at that. Mm-hmm. And even if you don't perhaps like the subject matter, it's, friends and there's how their lives are kind of dysfunctional, but dysfunctional together, and they come back and forth. It's worth going. It's worth supporting. It's happening this weekend, August 8th and 9th at 7:30, and then August 10th at 2. Tickets are $20 in advance, $25 at the door. Anytime you go to one of David's productions, it's top notch. It's interesting because in this particular production, it was a direction from the person that wrote this play. The actors actually change and get makeup done on set, so you see that as well. They don't go off screen; they do that right on set, and it's pretty interesting. So support the local theater scene. We interestingly went on Sunday to Weston Playhouse to see White Christmas, thanks to my sister, because you know what a White Christmas fan she is, and I would dare say that anything produced by David is same quality as anything you're going to see at Weston. So there, it's on record. So go support Wild Goose Players, see Gruesome Playground Injuries, and I suppose that there could be a gruesome playground injury that required urology. I'm stretching here.
Perfect
I'm stretching
segue.
here, but I'm
There's
segueing.
one-
I've seen them.
I always try to get a segue, and it doesn't always work. I have to
It did
reach
work.
sometimes.
Yeah.
I reach sometimes. So welcome.
Thank you very much for having me.
Yes.
Appreciate it.
So tell us a little bit about yourself,
Yeah.
where you're from,
Sure.
how you got here, that sort of
Yeah.
And don't say in a
background
car.
story.
Yeah, no, I walk.
waiting.
So
Not from Krypton.
No. Well,
You can't tell.
before,
us.
yeah, I don't want to talk about it. But so I am from Concord, New Hampshire.
Just like Krypton.
Yeah, very much. Actually, they shot the last Superman in Concord, New Hampshire, and I come out to Springfield Hospital, where I've been covering urology for going on 5 years now.
Wow.
And we have a really robust program. We have myself, Dr. Man Fuentes, we have Dr. Marks, and then last month, Dr. Cotter and the gynecology department was here. So We've been growing and expanding our service lines at Springfield, and it's been working really well. Originally from Connecticut, did my training in Connecticut, and did an oncology fellowship down in Bethesda at the National Cancer Institute, and ended up here.
But you did go to Middlebury, so you
I
have a
did.
Vermont
I did go to
connection.
Middlebury College, and that is, we were talking about this,
Yeah.
before we went on the air, and that is where my love
Your
of
Vermont
my
connection is,
Vermont roots, and
yeah.
my parents spent time in Castleton, so I kind of, by driving from Concord to Castleton enough, we kind of got familiar with this area and loved it, and wanted to spend time here, and kind of found Springfield Hospital.
Awesome.
Yeah.
So, I guess Mike was probably in the question last week, like, what are all the things you do?
Yeah.
And it's my turn to be, what are all the things you do
Sure.
in urology?
What is urology?
Yeah.
What does it cover, and what do you?
Yeah, so basically, urology will deal with issues related to the kidney, the bladder, the prostate. So any urologic organs that we deal with at Springfield Hospital, like kidney stones, urinary issues, certain types of tumors of the prostate, tumors of the kidney, tumors of the bladder. So really, just about everything related to any urologic issue.
Yes.
Are there any, I know that last week Dr. Cotta talked about a CESA procedure. Are there certain procedures that you guys do that are kind of newer or more?
Absolutely. Excellent question. So one thing that I'm very proud of at Springfield is that we have 3 urologists, all of whom are fellowship trained, all of whom are real specialists in their field. And one thing that we've started at Springfield Hospital that is, very progressive, and I would say probably only the second hospital in Vermont, and still to this day the only 2 hospitals in Vermont that offer MRI guided biopsies of the prostate using special technology to localize prostate cancer using MRI guidance. And
Wow.
that's something that is very unique to Springfield Hospital, that a lot of departments in the country that are substantially bigger than Springfield still do not offer. It's something that allows, in this case, men with a rising PSA, which is a prostate cancer screening test, to be screened for prostate cancer using an MRI, which sometimes even negates the need for a biopsy, which is an invasive procedure. And then if we do progress to a biopsy, it allows us to target a specific area as opposed to just systematically taking some biopsies, in a random sort of way. So Springfield has been doing this now for over a year. We've been logging all of our data. Our outcomes are fantastic in terms of not only not doing biopsies on men who don't need it, but then on finding prostate cancer in men who might otherwise not be diagnosed with prostate cancer.
That's huge.
It is
That
huge.
is amazing.
We can, we are very thinking, I think we'll talk about this in a little bit, but access in this area is a very big problem. And especially, my background is in cancer, and when you're dealing with cancer-related issues, no one wants to hear that, oh, by the way, your
You have to
PSA is elevated, and good luck getting an appointment.
Yeah.
I don't know if I won't mention other hospitals in this area, but we know who we're talking about. Good luck getting in to see any one of those, doctors in 3 or 4 months. Well, you can come to Springfield Hospital and see someone with the same training, or better training, in a short period of time, within a few days, and we can take
Really
care of
start dealing
right.
with
And then
the
you're
problem.
dealing with the physician. You're not going through multiple layers. You're not dealing with residents or a lot of administrative staff. It's usually, in this case, for example, it's me. So the reality is, if you come in and need a fusion biopsy, I'm the one doing it, and that's what I've trained in, and that's what I've been doing in Concord for over for about 10 years, and in fellowship prior to that. And it's something that we do routinely, and I think as patients, we want to hope that we can get in quickly and see the doctor and have a plan and start tackling the problem. And that's something that we can do and have been doing now for well over a year in Springfield with excellent outcomes.
I think there's a familiarity component too. So you obviously usually get a referral from a primary care physician. So more than likely someone's gone to a North Star primary care physician, which is located very closely and works very closely with Springfield Hospital. So they refer. So you kind of have that familiarity, hometown feel, versus you're going, say, 45 minutes north, crossing a river.
Yep.
And there's you're you become not this. It's not that same experience. You kind of become I don't want to say a number. I don't want to be that derogatory, but and then there is some red tape things that come because you're crossing states, getting the documentation. I'm assuming even though there's medical records, everyone does. Is it true that people use different systems of medical records? So it's hard sometimes to get the information from the primary care to the doctor if they're not on the same medical record.
Right.
Yeah. So I think there's those little logistic things that when you hear the word cancer and you start extrapolating, that those little things, if you can take those little things away and make the whole process more fluid, it's so worth it.
Right. It's anxiety provoking enough to even just be told that maybe someone's going to work you up for something that may be there, whereas you want to take away any additional stressors that are totally unnecessary. And waiting 3 months for an appointment, parking a mile away and trying to shuttle to a hospital, having a provider who is doing it because that's kind of what they're just there. They don't necessarily know you or the background much. That's not something that you'll get at Springfield. Most of the primary care providers in this area have my cell phone number. If there's an issue, they usually call or text and get patients in. You don't even have to go through that way. You could call the urology office right now and probably, speak to someone within 2 to 3 rings and get an appointment within a few days. That's just the way we do it. We will see patients when they need to be seen. We're not going to put patients on wait lists and call back. They're going to come in, they're going to be seen, and that's the end of it, because patients want to know, and it's just the right thing to do. And it's something, again, going back to being in a community setting, these are patients that all live in and work in the community. A lot of times, people that work at the hospital know the patients. They are friends, they're neighbors, they're colleagues, and we want to get them in not only because they should be in, but also because we know them and we want to help them. And that's the whole nature of being in a small community hospital. I mean, there's obviously, you don't have the resources that a larger facility would have, but with the resources that we have, I think we do an excellent job of treating the patients.
And I think, so I said I wasn't going to get political, but
Do
I
it.
am.
You need those clicks.
I am. I'm going to just put out there to folks when we're talking about local hospitals and the access to local care, that there's a lot of things happening at the state right now where I don't know, there seems to be, and this is my opinion, there seems to be a disconnect between what legislators are deciding is going to happen with healthcare in the state of Vermont and what is best for the people in the state of Vermont. And being a Vermonter born and bred, having access to care locally that I want to go to, that I want to support, versus being told, no, you got to go to a regional location now. There's going to be a north, a south, and a middle location to go to. I think we need to talk to our legislators. We need to start speaking out, because hospitals are under an amazing strain right now. They're being told how to do their budgets. Springfield has all of these things that they're doing wonderfully, and they're kind of being told, wait a minute, don't grow stuff, don't increase your budget. And again, I'm kind of making it simple. It's not that simple. I'm just making it simple because that's how I understand it. If I was working in the hospital, it's a lot more complicated. And then it comes down to the fact that if you don't support your local hospital, if you don't support your local healthcare provider, they're not going to be here. And really, if they leave, who's going to come to a state where it's really hard to practice? I'm sorry, I got political.
Yeah. Well, I think that there's a big part of that people think you have to be in a city to get good care, and it's a little bit of that ivory tower mentality, which is, you have to be in Burlington or Hanover. And a lot of the people that are coming up with policies are in those locations, and probably for a lot of them, it's not that hard to call someone and make an appointment at UVM in Dartmouth. I would challenge anyone to get on the phone right now and get an appointment in the urology department at any one of those 2 facilities before the end of the year. That's not going to happen. And if you have access to the same quality physicians
that's what
locally,
gets me.
then you don't have to go to those places. And I think people don't realize that actually you hope you go through, in urology, you go through 4 years of med school, 6 years of residency, 2 years of fellowship. You come out, you're well trained, you're trained whether you're at Springfield or you're at Dartmouth or UVM. So I think the quality of care that you're receiving is on par, if not better, because you are dealing directly with the physician. There's not a lot. It's not a teaching facility. We don't have
right.
we don't have layers of students and residents that are also going to be poking and prodding you. You get direct physician care, and that's something that I think is very unique to some of these regional
Those
hospitals.
are like keywords right there, direct physician care.
Right. And I think, again, part of it is just that the people that come up with policies, it's not only in Vermont, it's everywhere, are not necessarily
And they're
susceptible to
under
the same
strain too.
policy.
I'm not saying they're not. They're under strain too. So I'll just
could
throw
say-
that in there. You can say that.
I could say that. Yeah. If I'm not invited back, I'll know why. But no, I think that's a big part of it, and it's I don't know the Green Mountain Care Board. I'm not familiar with who they are or why they even exist in the first place. But the fact is that if a hospital is doing well and is providing good quality care, then they should be allowed to continue to provide good quality care. And I think that at a place like Springfield, you say, well, where would you send a relative to, right? That's always, people ask me, would this be something that you would advise for your father? Yeah, I would. Any one of the providers at Springfield, I would feel very comfortable referring any of my family members to. And, in the urology department, which is near and dear to me, or in gynecology, which, I work very closely with, the orthopedic surgery department, general surgery, all of these departments are departments that I would send any of my family members to, because you are directly accessing physicians who are extremely well trained, who have been doing this for, in multiple cases, decades upon decades in the area, and I trust them. And when you go someplace and you don't know who you're going to see, and you don't know if there's going to be trainees involved in your care, and you don't know if you can even get in anytime soon, to me, why should we be necessarily supporting that at the expense of regional care? And I don't think we should. I think both are not mutually exclusive. And unfortunately, in the state, it's turning out that no, resources are being funneled into hospitals that don't necessarily provide the care that we do.
Sorry, Mike, I kind of went off on a tangent.
No.
Sorry.
That's not. I like tangents. I was going to come back to bringing us a little bit back. I was fascinated by the idea of an MRI guided biopsy, because this seems mutually exclusive to me. Because whenever I've done MRIs, it seems you're pretty much isolated into that thing.
Yeah. So that's good question. So historically, if you wanted to do any sort of MRI guided biopsies, you would have to finagle a way to get equipment into a very scary big magnet, and that's usually a recipe for disaster. So over about 15, 20 years ago, actually out of the National Cancer Institute down in Bethesda, they derived a system where you can actually use the MRI that you've already had done and enter that into a special system,
it's
a
like
program.
a map.
It's exactly what it is. It's a roadmap.
Neat.
So we can actually overlay the MRI that you had done a week ago, 6 months ago, a year ago, onto an ultrasound that we would be doing in real time, and use the MRI as a map to target a specific area. The idea being that if we see something, why are we just hoping that we can hit it, which is what we've been doing historically in urology for 50 plus years, whereas now it's like, no, we have a roadmap, we know what the area of concern is, let's target that area. And then
Do you put down like markers then? Is there like what creates the grid?
So the program, the computer program that we use, Navigo, is the grid system. But then you could take it one step further and say, for example, in breast cancer, radical mastectomies were common decades ago because they felt, well, we just need to remove all the breast tissue, and now we're radiology is localizing it. You could do partial mastectomies. You could get other sort of adjuvant treatments, be it radiation, chemotherapy, hormone therapy, all three. And in urology, it's similar, where we are now moving towards, well, if we could target a specific area on a biopsy, then why not treat that area instead of removing the entire prostate? So, what I could see as a vision for Springfield down the line and in the not too distant future is using ablative technologies, whether it's ultrasound or freezing or laser technology, to actually destroy the tissue that you're finding that has cancer cells in it on a specifically, MRI guided biopsy. So that's the future. And I'll tell you that the future is bright in that regard, and it works well. And it's something that, I hope in the next couple of years to roll out in this area.
Yeah, because Dr. Cotter was talking about using ablative chair.
Yeah.
Is that what
for
the
a fibroid.
Assessa?
Yeah,
Is that what the
yeah.
Assessa
So
procedure is?
exactly. Yeah.
So you guys are really getting
Yeah, I think it's, again, it goes back to what we were saying before, is that you don't have to be at a huge facility to get quality care. A lot of the technology, if you have the people that know how to use the technology, is in the community. You just need to have a hospital network like Springfield that supports physicians like me in bringing their vision to this area. So that's something that Dr. Cotter or Dr. Balcom in gynecology, or Dr. Manfuentes, Dr. Marks, myself in urology, this is something that we're very passionate about, and something that I think, with the support of Bob Adcock, CEO and board of trustees, is something that we're able to provide.
I'm curious because Dr. Cotter mentioned, like, with when a female comes to her and she says, "I've been having this for a while, and this has been the problem, and I don't really think it's a big deal." And Dr. Cotter realizes oftentimes it's a big deal if somebody's complained about it. Do you find the same kind of thing with men when it comes to prostate issues, that they really don't want to come and talk about it? They really don't want to. They think it's not a big deal. Are you finding that there's that's the norm, and is there, like, would you encourage them to, even if you don't think something's going on, just regular checkups?
Absolutely. And a lot of the checkups can be done through primary care providers in the form of prostate cancer screening, like PSA testing. There is some controversy, which is going to be beyond the scope of a 25-minute show to talk about prostate cancer testing, but most urologists would agree that for relatively healthy men, somewhere between the ages of 50 and 75, that getting routine PSA testing is appropriate. But it's not even just that. It's urinary issues. It's concerns over sexual function. We in urology, we also treat women with incontinence issues, which is what Dr. Marks, hopefully he'll be on the show at some point and he could talk about. But he's doing very advanced surgeries at Springfield to help women regain continence after prior surgery or childbirth, or just something that can happen over time. And that's something that we can offer in Springfield again. So it's not for me, a lot of it is men with cancers of the prostate or the bladder or kidney cancer. But in reality, urology covers a lot of benign things that people don't necessarily want to talk about. Well, okay, so men might wake up 4 times a night, and that's for them, that's normal. It's like, it doesn't have to be. And there are ways that we can address that. They just need to be willing to come in. And sometimes if it is a smaller environment where you are talking directly to a physician, there's not a lot, we don't have students popping in and out or residents popping in and out, it's just us, then a lot of patients feel more comfortable. It's a very comfortable environment to be seen.
So this segue, I'm spot on.
Okay.
So we're going to put up a slide to show how they can reach the urology department, which is it's urology suites on level D in the Springfield Hospital. The phone number is 802, there we go, 802-886-3556. Those are the 3 doctors that you will see in urology, and really encourage people to, if you like what you heard today and you have any issues, make sure you reach out.
Absolutely.
Just want to make sure we got that in. We got about 2 minutes. We have just about 2 minutes. I want to make sure we got that connection. But you're right. You guys have the topics that people don't necessarily want to talk about.
Yeah, and and you don't have to. There are plenty of patients that come in sometimes and their chief complaint is, wants to talk to the doctor. That's okay. Like you could just come in and you don't have to tell everyone about your concerns, and you can come in and you can talk with one of us. And people are always like, I'm so embarrassed. If they think for a second, I'm going to remember what they were complaining about when I leave. Their bladder issues are not on the top of my priority when I go home.
When you run into them in the coffee shop, you're not going to go, wait a minute, maybe you shouldn't have that much coffee.
Exactly. Oh, now I see what the problem is. Yeah. So exactly. We are very compassionate. We and have short-term memory, so that's
there
fine.
You go. Perfect combination.
Perfect
combination.
Right.
Is there anyone? We've got about a minute. Is there any one thing? Have we missed anything that you wanted to tell the public?
No, I will say
green light lasers.
Oh, we do laser. Yeah, so we'll do green light laser surgery. That's surgery for the prostate, for bladder issues. We'll do kidney. We have lasers for kidney stones, for bladder stones. We got lasers all over the place. Everything. You need a laser. We got
sharks with lasers.
Oh, we have new kidney stone. We actually have one of the more advanced lasers for kidney stones that actually resides in Springfield. We have special technology to get out larger kidney stones. We have everything.
There you go.
Well, Well,
On that
thank you
note,
so much for coming.
thank you so much.
Oh,
for
it's
coming.
my pleasure.
Very
It's
good.
been
Yeah,
great.
of course.
I hope you will come back. Yes.
My kids are going to be so excited that I'm on YouTube. Hey,
You've made
that's
the
why I'm
doctor-
here. Yeah.
YouTube, yeah.
Oh, yeah. Hey, guys. Yeah.
All right. Goodbye,
Bye,
community.
community.
We'll see you next week.
Mike and Marty on